I'm going to begin by providing my patients with some privacy. Hi, my name is Missy. I'm going to be your nurse for today. Can you say your name and date of birth for me, please? I'm going to verify. Okay, good. I am going to explain the procedure. Today we will be putting in a urinary catheter. Any questions? No? Okay. Next I'm going to position my patient. Okay. Alright. Okay, I'm going to lay Chuck down at the end of the bed. Alright, and before I begin, I'm just going to make sure my patient doesn't have any allergies to iodine or latex. And then I'm going to verify in his chart. Okay, next I'm going to begin by opening my catheter kit. Okay, now I'm going to provide hand hygiene. Normally this would be done at the sink with warm water, but in this video, if you're else going to do, I'm going to don some sterile gloves. I'm sorry, first I'm going to open my kit away from me. Careful not to touch the outside. Okay, and within the 1-inch border, I'm just going to maneuver it. Okay, good. Now I'm going to put on my sterile gloves. Careful only to touch the outside of my glove. Okay, then I can. Okay, good. Now I'm just going to organize my sterile field. I'm going to begin by taking the 2 boxes and separating them, still remaining within my 1-inch border. I'm going to place down my sterile field. Shiny side down. Oops. Careful not to touch the legs. Okay. Now I'm going to begin preparing my box. I'm going to open my sterile swab sticks, make them readily available. I'm not using this, so I'm just going to discard it. I am get more swabs ready. The lube I'm going to open, and I'm going to take the catheter carefully out of its packaging, and I'm going to stick it in the lube. Okay, just going to place that in there. Next, I'm going to attach the syringe filled with water to the port. Just somewhere in here, right here. Good, make sure it's nice and secure. Okay, I'm going to discard this tray. And I am going to just move this more in the center, and I'm going to extend my sterile field carefully onto the bed. Okay. Good. I'm going to begin by cleaning. I'm going to use my non-dominant hand to spread open the labia, making sure to keep it open. I'm going to begin on my patient's right side, top to bottom, twirling motion. And then left side, top to bottom, twirling motion. And then once down the middle, top to bottom twirling motion. Okay, I'm going to repeat this twice. So I'm going to top to bottom, least to most contaminated, twirling motion. Careful not to close the labia. Top to bottom, twirling motion on the other side, and then once more, top to bottom, down the middle. Down the middle. Good. Okay, I'm just going to discard stuff I don't need. Okay, next I'm going to take my catheter out of the lube. Okay, and I am going to insert it until I see a urine return. When I see a urine return, I'm going to continue going 2 to 3 more inches. Next, I'm going to inflate the balloon, depending on the kind of catheter you have. This one is 5 milliliters, so I'm going to put in 5 milliliters. Okay, I'm going to tug to make sure I feel resistance, which I do. I am then going to dispose of my garbage. I'm going to secure the catheter to my patient and then secure the drainage bag to the bed, making sure there's no kinks like this one. Okay. Alright, once again I'm going to secure it. Then I'm going to dispose of my garbage, return my patient in a comfortable position. Also, I'm going to label the bag, making sure it's below the patient's bladder with my name, date, and time of insertion. I also want to make sure it's on a stationary part of the bed. Okay, I'm applying my patient's comfort, and I'm going to remove my gloves, perform hand hygiene, and return my patient to the lowest position in the bed, along with the call light in reach. Okay, and then I'm going to leave. Okay. Hi, my name's Missy. I'm going to be your nurse for today. I have an order to remove your catheter. Do you have any questions? No? Okay. Before explaining the procedure, I would identify the patient and make sure that it's the correct one by looking at his bandage or his wristband. I position the patient appropriately and gather my supplies. Okay, this is a clean procedure, so I'm just going to wash my hands and put on some clean gloves. Okay. Gonna expose only what I need to. I'm gonna push my patient in the correct position. Place my waterproof chuck down because it can get a little messy at times. I'm going to detach the catheter from my patient's leg. And I'm going to deflate the balloon depending on how much the chart says was injected, which was 5 milliliters. So I'm going to wait until 5 milliliters are back. Okay. Then I am going to, in a smooth, continuous motion, pull the catheter out of my patient. Unclamp it from the bedside. Wrap everything up. Dispose of the material. Return my patient to a comfortable position, restoring privacy. Okay. Wash my hands and chart the removal of the catheter.